Hello everyone, my name is Freddy and today we're going to present to you guys my case study number 3. Let's get started. So a little bit of background. Today we have Roberto. He is an athletic trainer working for a PT group at a local high school. He encounters an athlete that is hurting from an injury that's 1 month old, a back injury. Roberto points out the importance of seeking professional help. Roberto is also concerned that the athlete may have a serious condition and suggests an evaluation by a medic. However, the team's physician does not see any back patients. The athlete insists in participating in an upcoming event that they have. However, Roberto is not comfortable allowing her to play without an evaluation. Roberto explains his concerns to the athlete and calls her mother in regards of managing the athlete's injury. The mother feels confused and uncomfortable between what the athletic trainer can do and what the rest of the careers that he suggests are able to do. The mother starts suggesting to get treatment by a family friend chiropractor. Also, the mom's work schedule is hectic and is used as a barrier to not seek the help that this athlete needs. Roberto is now in a position of explaining each professional discipline of the experts he suggests without creating any negative perceptions about any of these careers. Let's get started. The first question, what are the appropriate referrals Roberto can make for further evaluation? Athletic trainers can refer to another doctor, another physician for the correct assessments that should be done. Also, speaking to the management or the athletic directors can be helpful to seek a different solution if the team's physician does not want to take the athlete. Everything will be for the best health interest of the athlete and the school setting. What steps could Roberto take in advance to make this situation easier to manage in the future? I would suggest a preseason meeting. It should be advocated across the whole staff and the body of the athletes. These including the parents to promote and educate their household. This will help a lot since people sometimes are not very familiar with the career of athletic training. With these meetings, problems or situations like this will be prevented and avoided, and the correct help with the appropriate referral to professionals will be easier and more efficient. Next question. To whom is Roberto primarily responsible and why? The primary responsibility of the ATC is the athlete. However, following the appropriate protocols and ensuring professionalism is the golden standard. He is accountable for the care and well-being of the patient since he is the first line in care when emergencies like this or when injury starts to happen. What potential issues might Roberto encounter based on referral discussions? Well, in the case, we can appreciate the issue of the medic not wanting to take the athlete. However, this can be avoided by referring the athlete to seek another physician, a back specialist in this case. This might be one of the biggest issues on the referral discussions. Therefore, education is key. Educating others will help minimize these discussions and will prompt the best practices of referring the correct medical help needed by the athlete. What would you regard as best case scenario for medical management of Kim's injury and why? Well, the best case scenario for the medical management of Kim's situation would be the physician taking the patient And if he's not able to find a solution, referring the athlete to a back specialist where he would assess and find every dysfunction or imbalance the athlete may have, promoting the best care for the patient when he returns to the athletic training clinic. And here the athletic trainer will have the complete treatment that will better the situation for the athlete and for everyone. Describe the academic preparation and scope of practice of each healthcare profession to Kim's mother. Well, let's start with athletic trainers. Athletic trainers specialize in the management of prevention and recovery of injured athletes, focusing on the sports population. That would be a very good point to make to Kim's mother. Also, athletic trainers collaborate with doctors to provide emergency and follow up care and together develop injury prevention and treatment programs for injured athletes. A bachelor's degree is required minimum. Now, a medical doctor, also known as an MD, is a doctor of medicine. These individuals assess patients, diagnose diseases and illnesses, and treat a variety of conditions. They may order and perform tests and use these tests to diagnose and treat their patients. They are the leaders of your healthcare team. Right here, I will point out to Kim's mother that a medical doctor and an athletic trainer, they both work together for the best interest of the athlete. Now, a physical therapist, these individuals evaluate and record a patient's progress. Physical therapists help injured or ill people improve movement and manage pain, very similar to athletic trainers. One of the big differences is that athletic trainers focus on athletes, and to be a physical therapist, you need a doctorate degree. Last but not least, the chiropractor. The chiropractor, their goal is to relieve pain and improve function. They do not prescribe drugs or do surgery. They adjust or manipulate your spine and other body parts to get them in the right position or proper alignment. I would also explain to Kim's mother that all of these specialists are well-trained health professionals that seek the wellness of their patients, and that referring Kim to a physician will be the best option for her to seek the best treatment that she could have. And that'll be all. Thank you.